Copyright, University of South Australia. This recording may contain third-party copyright material. Apart from any use permitted under the Copyright Act 1968, no part of this recording may be reproduced or rebroadcast by any means or process without the prior written permission of the University of South Australia and the copyright owners.
Welcome back. So, one more group of muscles that I'd like to talk about today, we call the rotator cuff. So the rotator cuff is the common name for a group of muscles which are responsible for creating as much stability as possible around the glenohumeral joint. So the glenohumeral joint, we know as our shoulder joint, is a fairly unstable joint because we know that it has a shallow fossa and a large articular head, so therefore is going to have more mobility but less stability. So if we identify these fossa, again, here we have the spine of the scapula. Remember, that's our dead giveaway for posterior view. This is the supraspinatus, or the fossa above, and infraspinatus fossa below. All right, and inside these regions here is where the muscles of the rotator cuff live. We also have another muscle which lives on the anterior side. Remember that larger smooth surface which would be sitting against the ribs, so we call our subscapular fossa. The names of the muscles, we can remember them by remembering the term sits. Because these muscles, they sit upon the head of the humerus, or the proximal end of the humerus, and they help to pull it into the glenoid fossa to give it as much stability as possible. So, I reckon if I wrote the name of these muscles down, supraspinatus, infraspinatus, and subscapularis, you'd have a pretty good idea about where they go. But this one, Terris Minor, you're thinking, well, there's no Terris fossa in here, so it might be a bit more confusing to place. But if we go and we put them in, what we can expect is that, yes, this is the supraspinatus fossa, so we're going to find our supraspinatus muscle. So our supraspinatus muscle, originating from that supraspinatus fossa, will pass out underneath the acromion. Let's have a look at that. So here we can see our supraspinatus fossa. Can you see this gap here? This is where the muscle will travel through. All right, and what we would expect then is that we're going to find the humerus here, and it's going to pass out and attach to the greater tubercle. So it passes out underneath. You can put some dotted lines there if you wish. And it passes out here, attaching to the greater tubercle of the humerus. Now this muscle here, on its own, will be an abductor. So if we imagine we put a line or an arrow to represent the shortening of this muscle, it's going to create abduction of the humerus on its own. Infraspinatus, good guess, is going to be coming from our infraspinatus fossa. So our infraspinatus fossa here, like this, and we have our infraspinatus muscle passing out and attaching once again to the greater tubercle of the humerus. Now, we can see here that these lines are to represent the direction that the muscle fibre exists, so it's going to have an action of rotation. It's going to rotate it externally. So we would say lateral rotation or external rotation. Lateral or external rotation of the humerus. Your Terris Minor muscle is, as you guessed it, a small guy. The word Terris means round, minor, small. It's fairly well associated with the infraspinatus. So it lives just below it, all right? Its muscle fibers run in the same direction. It comes instead from the lateral border of the scapula. Just here, can you see that little small facet there? It then passes up and out and attaches to the greater tubercle just below the infraspinatus, and will therefore have exactly the same action because its fibers run in the same direction. Subscapularis, on the other hand, as you would have guessed, will come from the subscapular fossa. So here, subscapularis has an upper half and a lower half, and instead of going posteriorly and attaching to the greater tubercle, this muscle here will pass anterior to the glenohumeral joint capsule and attach to the lesser tubercle. So instead of creating external or lateral rotation, you are now going to be imagining that it's going to create internal or medial rotation of the humerus. These muscles don't work in isolation though. These are a rotator cuff, all right, and we give this a name because it helps to create rotation around the humerus or pivoting around the humerus, but its major function is for holding the head of the humerus deep inside as deep as it can go inside of the glenoid fossa. So if we think about subscapularis, it would come from the subscapular fossa and attach here to the lesser tubercle. So when it pulls, it's going to create internal rotation of the humerus. If we think about the posterior aspect, here we have Infraspinatus and Terris Minor. So when they pull in this direction, they're going to create external rotation of the humerus. Supraspinatus, with its muscle fibers passing through here like this, attaching out onto the greater tubercle, will create abduction as it pulls. And this is important in order to clear the greater tubercle from this acromion, which we discussed a little bit earlier. But if we have a posterior group pulling this way, a superior muscle pulling this way, and an anterior group pulling it in, that means all of them together would pull this in and try and house it as deep as possible. So think of it like reins on a horse. You're riding along and you need to stop the horse, so you pull its head, and the reins from the left side and the right side pull in, and it will stop the horse from moving. So that's how they create stability around the glenohumeral joint, by pulling in on the head of the humerus and forcing it into its socket. These muscles here are commonly damaged in exercises or activities like kayaking, things like this. They can even be damaged in basic things like throwing a tennis ball, or when you fall over and you catch your arm in a wrong position. So rotator cuff tears can be common, but you don't want one. They're going to cause you big troubles down the way. So these are the rotator cuff muscles.